Arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The following programming is furnished by you and your doctor.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, everybody from South Florida, and welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare, a Medicare certified home health agency that is here for your home health needs. Tonight, we have a very special guest. We have Dr. Jessica Bucco from Baptist Health Medical Group at Bethesda. Dr. Bucco is a general and endocrine surgery specialist, with her office located conveniently right across the street from Bethesda Hospital East in downtown Boynton Beach at 2800 South Seacrest Boulevard, Suite 280, Boynton Beach, 33435. Please write this number down. Dr. Bucco can be reached at 561-736-8200. Once again, let's introduce Dr. Jessica Bucco. Thank you for joining us on our radio show.
Thank you so much, John, and for All County Healthcare for having me. I'm excited to talk to you this evening.
Excellent, excellent. So, Dr. Bucco, tell us a little bit about what you do, your typical day at your office, and then your surgical procedures that include general surgery and endocrine.
Sure. So as a general surgeon, and I did my specialty in endocrine surgery, I see patients in the office a few days a week. I have scheduled operating room days as well. And then I also help run the wound care clinic at Bethesda Hospital.
Wonderful.
So a little mix of everything in there. Each day is a little bit different. And I think that's one of the reasons why I like being a surgeon. I'm not just in the office all day. I kind of mix things up.
Oh, that's absolutely fabulous. And so our audience can better understand what exactly type of surgeries does that entail, both general and endocrine?
Sure. So endocrine surgery, I'm the only fellowship trained endocrine surgeon in Palm Beach County, so that's something a little bit different about me. A lot of people don't know, though, what an endocrine surgeon is. So a little bit about it is, mostly I deal with thyroid and parathyroid disease. In regards to the thyroid, I'm dealing with thyroid cancers, which is something I'm really passionate about taking care of, patients with thyroid disease and thyroid cancers. Also patients with large goiters. I follow patients with thyroid nodules as well. The parathyroid glands are not really known by everyone, but they're important as well. They help produce our body's calcium, and I take care of patients with hyperparathyroidism. And then I also deal with adrenal tumors and endocrine tumors of the GI tract and pancreas as well.
Wow,
so that's endocrine surgery a little bit in a nutshell.
Fascinating, fascinating. And what brought you, bring us back a little bit with growing up, what brought you interested in studying medicine, and then specifically why you wanted to become a surgeon?
Sure. So, from a really young age, I was always a math and science kind of kid. I grew up, though, watching ER with my parents, and I was drawn to kind of the chaos of the emergency room and the doctors on that show. And really, I ended up going to Johns Hopkins for undergrad, and, it's a big, heavy medicine school, and really, I just never looked back. Surgery, I didn't always want to be a surgeon. I didn't really know anything about surgery. I'm the only one in healthcare in my family, but I have a strong background in sports, and I think, you know, the combination of working with your hands and kind of the science and knowledge behind taking care of patients was kind of what drew me to surgery.
Wonderful, wonderful. So tell us a little bit more about your background in sports and where you actually played collegiate.
Sure, yes. So, yes, back in another life, I was a Division I athlete for Johns Hopkins University. We were nationally ranked multiple years while I was there. We made it to the Elite Eight one time, so that was pretty cool.
Absolutely.
I started out as a midfielder, and then I was an ice hockey goalie as well in high school, and one of our goalies got hurt, and we kind of had a need, and I made the transition mid-college to switch to goalie, and kind
Wow.
of took on a new position, which is really unheard of at the Division I level, but, you know, was able to help out. And you know, I think being a goalie is a little bit kind of like a surgeon. You know, you're the last line of defense. You know,
Absolutely.
so I think that's a kind of cool analogy to maybe becoming a surgeon as well.
Absolutely, absolutely. That's very interesting, and hats off to you, because I think being involved in sports in life helps people adjust to quite a few different things. It, you know, has a lot to do with teamwork and overcoming various challenges. What
No,
do
I
you think?
I think so, and I think, you know, endocrine surgery is a little less known, you know, field. You know, we hear about vascular surgery and colorectal surgery. You know, endocrine surgery is a lot about working as a team with, you know, the medical doctors who are taking care of these patients, seeing these patients with their thyroid disease, you know, the oncology team, the endocrinologist as well. So I think that's, you know, one of the reasons I was drawn towards endocrine surgery, because you really have to be part of a team and have a multidisciplinary approach to taking care of your patients.
Wonderful. I love that analogy. I love it. And then, you know, after Johns Hopkins, you were actually locally down here with the University of Miami, I understand.
Exactly. So I went to University of Miami for medical school. They actually had at that point a campus located here in Palm Beach. Now FAU expanded to have their own medical school. When I was in medical school, was University of Miami at FAU. But we were so successful, I guess, that FAU had developed their own program.
Absolutely.
And then I chose to stay down here with University of Miami up here in Palm Beach for my residency training. So I did my residency training at JFK Hospital nearby here. Also worked at the West Palm Beach VA, and then down at Miami. So
Wonderful.
I'm very familiar with the area here, and, you know, I've kind of developed roots down here in South
Excellent.
Florida.
Excellent. Well, you wear many hats, you know, and you have a lot of experience. That's wonderful, and we do all appreciate that, because, you know, down here in South Florida, we have a very large population of seniors, as well as we have many athletes that need surgical procedures done on a regular basis. And it's glad and very happy to know that Dr. Jessica Bucco is here, and she is here to take care of you guys. Remember, she's part of the Baptist Health Medical Group at Bethesda. Bethesda Hospital East is conveniently located right downtown in East Boynton Beach, and she can be reached at 561-736-8200. She's in Suite 280, which is right across the street from Bethesda Hospital East at 2800 South Seacrest Boulevard. So, Dr. Bucco, there's a developing issue that seems to be more prevalent now with women of all ages that you actually treat personally, and I'm sure a lot of our listeners and viewers would like to hear about the variety of treatment plans for thyroid issues.
Sure. So thyroid nodules are actually more common than you'd think. You did mention, you know, the aging population down here. About 50% of patients, of people, have thyroid nodules who are above the age of 65. So, you know, the key is knowing which patients need further investigation and potentially surgery. So I think, you know, that's, you know, why you would really see me as an endocrine surgeon, because, you know, I know the extent of surgery, and, you know, I'm doing lots of thyroid surgeries each and every week, and working. I have close relationships with many of the endocrinologists in town. But in women especially, thyroid cancer is actually the 6th leading cause of cancer in women. You know, a lot of times it gets overshadowed by lung cancer, breast cancer, but, you know, 6th isn't, you know, something to be, you know,
It's very concerning.
it's very concerning. And we're actually seeing an increase in incidence in thyroid cancer over the last 3 decades. But the good news about thyroid cancer is it's very treatable. One of the reasons I really actually am passionate about my job is, thyroid cancer has excellent survival rates if we catch it early and do the right surgery and the right intervention for you. So over 95% survival rate if detected early. So that's the good news, is I get to be a cancer doctor, but usually give my patients some pretty good prognosis. So that's always helpful.
That's excellent, Dr. Bucco. Thank you for that. And we want to let our audience know as well that you run the Oncology Cancer Tumor Board at Bethesda as well. That's very important and good for our audience to know.
So I did my endocrine surgery fellowship training at Sloan Kettering and Cornell. So big academic centers where we really had tumor board conferences where we took patients with their cancer diagnoses and got a bunch of opinions, different specialists on board, and that's something that Baptist has really encouraged me to get started, especially since we're now part of a bigger Baptist Health South Florida group. So we have, all my cancer patients and many of the other surgeons. We present their cases a couple times a month in a room full of oncologists, radiation oncologists, other surgeons as well. And I think it really does improve patient care. I do a lot of work with breast oncology as well. So those are kind of but as a general surgeon, I deal with colon cancer and intestinal cancer, stomach cancer as well. So I do think, cancer is a big buzzword now, and it's a scary diagnosis, and I think really patients need a lot of doctors to give them the best plan of care for them, because it's not one size fits all with cancer treatment.
Absolutely, and it is a scary thing, to know that these things come on sometimes unforeseen. Doesn't matter what your medical history could be in the family, and it is very concerning. But it's extremely important when you've got a surgeon that has a wonderful and intense background in it, as well as sits on the board to discuss it with other healthcare professionals. I believe, once again, teamwork coming into that, it plays a big role. And the more people on deck to help overcome some of these health issues, the better it is. So talk a little bit about you being a professor as well at the Florida Atlantic University.
Sure.
And the campus in Boca Raton.
So at Bethesda Hospital, we are lucky enough to be affiliated with Florida Atlantic University. Since I was a resident, I've been really involved in education at both the medical student and resident level. And it's kind of a side kind of passion of mine. So I've gotten really involved. We work with the residents, the general surgery residents at our hospital. But I was just recently, I'm serving as the interim associate program director of the general surgery residents. So one day a week I'm involved in their educational conferences. And I think working with residents is great, because they really push you to stay on top of all the current literature. I really enjoy teaching. So I think it's a great scenario. Yeah.
It's very obvious to everybody here. You're very passionate about what you do, and we can't be more thankful than that. I have a son that's actually starting at FAU in the fall, and
how exciting!
It's a beautiful campus. It's a wonderful school, and we thank you, because
we're training some great young doctors here in Palm Beach County. Our residents match to top programs throughout the country, and then hopefully we can recruit all of us who've trained at big academic centers to come here and really improve care in our community.
Oh, that's fabulous. Thank you so much. Folks, we're going to be taking a quick commercial break. We'll be back momentarily with more from You and Your
All County
Doctor radio
Healthcare
show.
has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back, folks, to the You and Your Doctor radio show, sponsored by All County Healthcare. All County Healthcare is a Medicare certified home health agency that is here for all your home health needs. We do cover patients in all three counties, Palm Beach, Broward, and Miami-Dade counties. And we're back here with Dr. Jessica Bucco, a general and endocrine surgery specialist from Baptist Health Medical Group at Bethesda Hospital East. Dr. Bucco's office is located conveniently right across the street from Bethesda Hospital East at 2800 South Seacrest Boulevard, Suite 280. Her phone number is 561-736-8200. And so, Dr. Bucco, talking about the typical patient that might come to see you, how would they go about making an appointment, and what type of insurance do you take?
Sure. So, patients can either be referred to me through their primary care doctor, or, some insurances don't require a referral, and they're welcome to call my office. The number again is 561-736-8200, and I'm happy to see any patient. But I take most insurances. I take all Medicare patients, and then most commercial insurances as well. So happy to work with you in your insurance plans.
Wonderful. That's good to know. That's good to know, folks. So if your primary care physician made the referral to Dr. Bucco, they could just reach her at, once again, 561-736-8200. It's very easy to find them. They're also on the Baptist Health Medical Group website, which is very interactive. You can just type in Dr. Bucco's name, and you'll get all the information there with a link to make appointments. So, Dr. Bucco, going back to our subject about cancer and it being a major issue and health concern, talk to us more about the causes of cancer. We know you touched upon the fact that sometimes it's genetic and sometimes it can be brought on by environmental factors. Let's talk about the environmental factors first. What would you think may cause cancer in the environment?
Well, we have found that thyroid cancer is associated with patients who are smokers, obesity as well, and then, if they've had any kind of radiation to the head or neck before, we found that's also a risk factor for developing cancer. I think we also are a good thing about the increasing incidence is that we're actually catching some cancers earlier. Excellent. We're catching a lot of thyroid nodules and getting biopsies of them because, let's say, someone's having cervical disc disease and problems, and getting an MRI, and they incidentally found these nodules. I think some of the reason that the incidence is going up is because we're actually having advanced imaging now for other reasons, and we luckily find these cancers at an earlier stage.
Oh, that's excellent. That's very good to know. Now, being here in South Florida, of course, a lot of us, we're outdoors a lot, and we really enjoy the outdoor activities. Talk about the prevalency of skin cancer and what other types of cancer may be brought about by, say, too much exposure in the sun or anything like that.
So I think a little bit about South Florida is great that you're getting outdoors and getting exercise, because that itself, being active, lowering your obesity risk, decreases cancer. So that's great. We definitely have to be safe in the sun here, because that is, a risk factor for skin cancer. But other than that, most cancers aren't infected too much by sun exposure. So that's a good thing down here. Hopefully patients are getting out and active, because being active is a good way to stay healthy. Especially because if we find a cancer, if your heart and your body is doing well, then you'll tolerate surgery.
Absolutely. Absolutely. So going back to endocrine surgery specifically, We know it also includes the parathyroid, the adrenal, and the neuroendocrine tumors. So can you expand on that a little bit?
Sure. So the adrenal and neuroendocrine tumors that you're talking about are really hormone-producing tumors most of the time. That, there is something called a pheochromocytoma that can be a surgical cause of high blood pressure in patients who have refractory high blood pressure. Sometimes they can, depending on what hormone they overproduce, can then cause, like, some produce insulin and can cause, fainting spells. Those are a little bit rare, but that's why you definitely need to see a specialist, because, I've been trained in, diagnosing and really treating these patients. Also with, the thyroid disease, just because you have a thyroid nodule doesn't mean you need surgery. It's really easy if we know it's benign and we know it's cancer. But when we get biopsies, sometimes we get biopsies that are kind of what we call in the gray zone. There's a Bethesda classification system. And what I do is I run extra molecular tests. I work with the pathology department to really better look at the genes that are associated with thyroid cancer, so that if something comes back, we're not sure if this is cancer or not, we can kind of put it in the more likely or the less likely to be cancer. Because just because we can do surgery on everyone doesn't mean we should as well.
Oh, that's very good to know. Absolutely. And being in the healthcare, field altogether, how often would you say is a good amount of time between, say, doctor's visits? Because a lot of people, especially our younger folks out there that I've spoken to out in the field, they tend to think having a physical once a year is good enough. But I myself believe that you should make more frequent visits to the doctor's office, especially to alleviate any kind of concerns you might have. What's your opinion on that?
Well, something I would say is, especially impacted by COVID, is that, a lot of people weren't seeing their doctors.
Yes.
So, obviously COVID is here, and it's here to stay for the next, while, at least while, we're working on vaccinations and everything. If you have a problem, make sure to see a doctor. I've seen a lot of patients present with, more advanced breast cancers or other ailments that, they've let go, or gallbladder disease, and they've been having multiple attacks but have been hesitant to see a doctor. So I think, regularly seeing your doctor is important, but especially if you're having symptoms, you should be seen by someone.
Excellent. That's very important. Thank you, doctor. Now, being part of the Florida Atlantic University board and being an associate professor there, I understand that you've written over 40 scientific papers, including several chapters in surgical handbooks.
Yes.
Can you please tell our audience a little bit more about that?
Sure. So I think research, in medicine and surgery is really important, because that's the only way we really are able to advance technologies. And when I was a resident, I was very interested in looking at analyzing outcomes and reasons for readmission, and really it's how we advance medicine. So it's something that's another reason why I like working with the university and with the residency program, to continue to stay active, in research and looking at your outcomes, seeing how things can be improved, seeing how things can evolve.
Excellent. Well, folks, that's very important. We not only have a wonderful, well-versed doctor, general surgeon, but she's also an associate professor. She loves to teach. She's got several other hobbies. We're going to ask her about that in a minute. But tell us something more about what's new in modern medicine and where the curve is starting to go, especially with surgical procedures.
Sure. So, in the early 90s, we were developing laparoscopic surgery, which were minimally invasive ways to, treat surgical issues. I've also been trained in robotic surgery as well, and can offer that to my patients. I don't think robotic surgery is the answer for everything, but I do think it has a niche in surgery, and, can make some procedures easier and have improved outcomes with patients. In addition, some of the newer advances are those molecular tests that I run on the thyroid nodules. And then, I think in general, we're just getting more efficient, working faster in the OR, but safer. For my parathyroid surgery, I do real-time parathyroid hormone monitoring, so I ensure that we get a surgical cure while you're under anesthesia. And really, I think medicine's come a long way. So
I
happy
do-
to be a part of it.
I do agree, Dr. Bucco. So I understand that your husband is currently studying to be a general surgeon as well.
Yes, so my husband, yes, we're a medical family. So my husband just finished his general surgery training here as well in Palm Beach County.
Wonderful.
And he's starting his cardiac surgery fellowship at MD Anderson in UT
Excellent.
Houston. So hopefully he'll be back in a few years here as a heart surgeon.
Oh, that would be an honor to have him here. And why keep it in the family? Tell us. I understand you have 2 kids.
I do. I have 2 kids. My son Luke just turned 2 on Saturday. We had a
Wonderful.
nice Toy Story themed birthday party, and I have a daughter Lola who's 5 months.
Oh, how do you do it all, Dr. Bucco?
It takes a village.
Well, apparently so. And once again, we want to thank you again for being our guest here. Folks, Dr. Bucco is a general and endocrine surgery specialist from Baptist Health. Remember, write this number down. You can reach her at 561-736-8200. Her office is located conveniently across from Bethesda Hospital East at 2800 South Seacrest Boulevard, Suite 280 in Boynton Beach. Thanks again and have a wonderful evening.
Thank you, John.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422 and we will put you on the air as soon as possible. Tune in next week for more information on living long